Hello everybody, Darren Reeves here with another DP Minute on comment number 14 of the QMSR. So, comment number 14 stated that one commenter recommended that the FDA retain in the QMSR the provisions of the previous 820.150, that's the storage category for the QSR, as the commentator suggested that ISO 1345 lacks requirements to prevent a manufacturer from using an obsolete product. So in the storage section of 150, it basically says that a company has to have a procedure in place to prevent the mix-ups and the use of obsolete product. And so the FDA responded, the FDA agrees that the specific language from the previous 820.150 docs does not appear in ISO 1345, but disagrees with the same concept is not covered within ISO 1345. So now they're going back to the concepts again. They're really trying to make sure that they hold ISO 1345 2016 verbatim as part of the regulation, or as the regulation. Clause 7511 of ISO 13485 allows a device manufacturer to have flexibility to use a risk-based approach to develop a process to preserve conformity of devices. Again, getting into the risk. We've seen that being heavily weighed in on the FDA now, as opposed to where it was with the QSR, where I had an FDA inspector tell me a couple years ago that we couldn't use a risk-based program, and I had to go back into the preamble to show them where we could. So that being said, the FDA emphasizes that this process should take into consideration that a nonconformity may not always rise to the level of a product defect or failure, but a product defect or failure will most typically constitute a nonconformity. Here's the kicker. More broadly, we note that one objective of the QMSR is to correct and prevent poor practices, not simply bad product. This is getting back into the culture of quality that they believe and are trying to instill in companies. So that being said, it's the culture of quality and the risk-based decision-making that they're really focusing on here. That's a DP Minute, and we'll talk to you soon.